Let's talk COVID-19, because if you think you're noticing a surge in COVID cases, local experts say you are right. And with so many people testing at home, it's hard to know the extent of the spread. Our Lisa Adams has been looking into the local surge. And Lisa, what we're learning once again from the levels of the virus that are showing up in our sewage locally.
I know it's not an easy thing to talk about, but Erie really was ahead of the curve on tracking the virus in our sewage, and that's thanks to Dr. Howard Nadworny from AHN St. Vincent for getting us into testing by a company called BioBot, and that data is showing a surge right now, and that's important because, as you said, home testing means health officials don't have a full handle on the data.
If you're hearing more lately about friends or co-workers with COVID, you're not alone. Dr. Howard Nadworny, still keeping tabs on the virus shed in our sewage, is really seeing it.
Is it your belief, based on sewage, that we have even higher case numbers here?
Oh yes. Actually, our sewage numbers over the last 2 weeks have surged to levels that are even slightly higher than they were at the peak in July and higher than they were in May with the previous variant.
The latest Erie County data shows 582 cases the week ending October 9, numbers that once would have been shocking. But with most people doing home COVID tests, that's just a fraction of the picture. And if you test as soon as you have symptoms, you may miss the truth.
So if you test right away and it's negative, that's not surprising. That happens actually to the majority of people. If you test on the third day of illness, then the majority of people with COVID will test positive.
Just in time, LECOM has extended its drive-through testing plus vaccine and booster services to 5 days a week at their Institute for Healthy Aging on Shaper Avenue.
So what made you decide to get boosted now?
Well, I heard on the news, on TV and stuff, that it's a good idea to get the booster, so why not?
And they're busy dispensing free therapeutics too, like Paxlovid.
There's been a very steady flow. The Paxlovid dispensing, we've been doing rather steadily and a considerable amount of it. There's days when it could be perhaps as low as 5% of what comes through. Days it could be 50%.
So, two messages from the experts. If you have cold or allergy symptoms, it could actually be COVID. And don't take that first test as a definite no if it's negative. Test again in a day or two. And until then, they say to wear a mask or just stay home. And Dr. Nadworny says the bivalent booster that's around right now and available is a perfect match for the type of COVID-19 we have here in our area. So he says go for it. It should make you miss or at least minimize illness in this surge. Live at the Alert Desk, Lisa Adams, Erie News Now.